Hey, it's Dr. Bill with just the tip of urology school. And today we're going to discuss scrotal masses. And what's very cool about urology school is you can bring your coffee to work. So enjoy your cup of coffee and learn. We're going to talk about scrotal masses, and it's important for you to reference some of the anatomy of the scrotal wall and the scrotal contents. And very commonly, we'll see something called a hydrocele, which is presents as painless swelling of the scrotum, not the testicle. And sometimes the fluid is so large that we can't even feel the testicle. That is something that can occur for a lot of reasons. It occurs spontaneously. It can be a function of some minor trauma, infection, and even some testicular tumors will present with a hydrocele. However, that's unusual. In all of these evaluations for scrotal masses, a good history, physical exam, and an ultrasound is appropriate. When you refer to your anatomy, you're going to see something called tunica vaginalis. There's an inner layer and an outer layer. And that the tunica vaginalis will be the walls of the hydrocele, and that's function of those walls is to provide fluid. So in a hydrocele, there's going to be some overproduction or under reabsorption of that fluid, and the hydrocele will form. Aspirating, putting a needle in and draining is not good. These masses or the fluid collections will reform, and with putting a needle in, you can cause some not only damage to the testicle, but you can cause some infection. So to address it, it's a surgical procedure, outpatient procedure that is relatively common. Sometimes you can get a swelling of the epididymis, the tubes around the testicle. Again, refer to your anatomy charts. And the epididymis, which carries the sperm from the testicle to the vas, can get swollen. A small cyst can develop. Sometimes those increase, and they're called a spermatocele. Different from the hydrocele, where the fluid envelops the entire testicle, the spermatocele is usually felt superiorly, posteriorly, or inferiorly in reference to the testicle, usually soft, minimally tender to palpation. Again, sometimes they're unsightly or uncomfortable, and they can be removed. Sometimes when patients present with infertility, those areas actually can be aspirated and sperm be retrieved for artificial insemination or ICSI, other procedures that you'll hear about that microscopically place sperm into the egg of the partner. Again, for treatment options, very rarely is it an issue. Sometimes they're excised. Sometimes the epididymal mass will not be fluid, it will be firm or solid. Usually in the 80-year-old male, you feel a firm area. You want to make sure that's not a cancer. There are some rare cancers, relatively indolent, but should be looked at or considered for excision of that mass if it feels solid, or ultrasound findings are of concern. Sometimes you get a hematoma or hematocele. That can be from minor trauma. If it's significant trauma, we can elicit that in a history and physical exam. Ultrasound is important to obtain to make sure that there's not disruption or rupture of the testicle itself. So look at that. That would have to be drained sometimes, depending upon the clinical findings. It can be very uncomfortable and take weeks to resolve. And so at times, a surgical procedure, a drainage procedure would be appropriate. Before you do that, you want to make sure that you have an ultrasound to see if you can preoperatively identify a rupture, which should be repaired as well. And then there are a number of inflammatory issues, epididymitis, again, history of an indolent increasing discomfort, usually associated with urinary tract infection or some mild trauma causing inflammation. There's some tricks on physical exam that you'll read about to help with that differential. And sometimes you have an abscess, commonly seen in immune-compromised patients. Diabetics may be associated with significant skin infections or Fournier's gangrene. That's something that does require a comfort level in assessing an immediate surgical involvement, because these inflammatory or infectious concerns with the scrotal wall can grow significantly. There are abscesses that are just plain pockets of pus, if you will. Most of the time, it has to be drained, depending on the conditions of the status of the patient. A surgical procedure can be done, or IV antibiotics, depending upon what the clinical status is. So a lot of different types of diagnoses that can be made in scrotal masses. Ultrasound, history, and physical exam are important, and a basic understanding of the anatomy. Dr. Bill, with just the tip of urology school and scrotal masses.